Please use subtitle translation to select desired language. Fatty liver disease, characterized by the accumulation of excess fat in liver cells. Here's a detailed overview of the causes associated with fatty liver disease. Excessive alcohol consumption. The liver metabolizes alcohol, and excessive intake can lead to fat accumulation as the liver prioritizes alcohol metabolism over fat processing. Obesity. Increased body fat, particularly visceral fat, fat around the abdomen, can lead to fat accumulation in the liver. Insulin resistance. Type 2 diabetes and metabolic syndrome can lead to increased fat storage in the liver. High cholesterol and triglycerides. Elevated levels of low-density lipoprotein cholesterol and triglycerides can contribute to fat buildup in the liver. Sedentary lifestyle. Lack of physical activity is associated with increased fat accumulation and is a significant risk factor for fatty liver disease. Rapid weight loss. Losing weight too quickly can lead to the release of fatty acids into the bloodstream, which may overwhelm the liver and lead to fat storage. Certain medications. Some medications, such as corticosteroids, certain cancer medications, and antiretroviral drugs, can contribute to fat accumulation in the liver. Hormonal imbalances. Conditions like polycystic ovary syndrome, PCOS, and hypothyroidism can increase the risk of developing fatty liver disease. Genetic factors. Some individuals may be genetically more susceptible to fat accumulation in the liver. Sleep apnea. Obstructive sleep apnea has been linked to increased risk of fatty liver disease due to its association with metabolic dysfunction and insulin resistance. Age. The risk of developing fatty liver disease increases with age. Ethnicity. Certain ethnic groups, such as Hispanics and individuals of Middle Eastern descent, are at higher risk for fatty liver disease. Gender. Males are generally at a higher risk for fatty liver disease, although postmenopausal women may also be at increased risk due to changes in body fat distribution. Poor diet. Diets high in refined carbohydrates, sugars, saturated fats, and trans fats can promote fat accumulation in the liver. Foods such as sugary beverages, fast food, and processed snacks are particularly concerning. High fructose corn syrup, HFCS, is a sweetener derived from cornstarch that has gained popularity as a sugar substitute in processed foods and beverages. HFCS is commonly found in soft drinks and fruit juices, baked goods, sweetened yogurts, condiments, like ketchup, snacks and candies. HFCS has been implicated in the development of fatty liver disease, especially non-alcoholic fatty liver disease, NAFLD. Here's how HFCS can contribute to this condition. 1. Fructose metabolism. Unlike glucose, which is metabolized by nearly every cell in the body, fructose is primarily metabolized in the liver. When consumed in excess, fructose are converted into fat. This can lead to an accumulation of fat in liver cells. 2. Fatty liver development. The liver becomes overloaded with fat, leading to fatty liver disease. 3. Impact on insulin sensitivity. High fructose diets can contribute to insulin resistance. Insulin resistance disrupts the normal regulation of lipid metabolism, further promoting fat accumulation in the liver. 4. Increased appetite and caloric intake. Fructose does not stimulate insulin secretion or enhance the production of leptin, a hormone that helps regulate appetite, to the same extent as glucose. This can lead to increased caloric intake and obesity. 5. Inflammation and oxidative stress. Excessive fructose consumption can lead to inflammation and oxidative stress in the liver, contributing to liver damage. Fatty liver disease, particularly in its early stages, often does not present noticeable symptoms. However, there are some early warning signs and subtle symptoms that may indicate the presence of fatty liver disease. 1. Fatigue. A common early symptom is persistent fatigue or a general feeling of tiredness that does not improve with rest. 2. Abdominal discomfort. Individuals may experience mild discomfort or pain in the upper right abdomen where the liver is located. This discomfort may feel like a dull ache. 3. Unexplained weight loss. Some people may notice unintentional weight loss, which can occur even without changes in diet or exercise. 4. Nausea or loss of appetite. Feelings of nausea or a decreased interest in food can also be early signs, although they are nonspecific. 5. Enlarged liver. A healthcare provider may detect an enlarged liver during a physical examination. 6. Dark urine or pale stools. Changes in urine color, dark urine, or stool color, pale stools, can occur, although these are more commonly associated with liver dysfunction. 7. Skin changes. Some individuals may notice skin changes, such as itchy skin without a rash. Areas of darkened skin, acanthosis nigricans, may occur, particularly in people with insulin resistance. 8. Increased sensitivity to alcohol. Individuals may notice that they become more sensitive to alcohol, experiencing adverse effects after consuming smaller amounts than before. 9. Mood changes. Some people with fatty liver disease report changes in mood, including irritability or depression. Making specific lifestyle changes can significantly help prevent or reverse fatty liver disease. Here are some key recommendations. 1. Maintain a healthy weight. If you are overweight or obese, aim for gradual weight loss. Losing 5 to 10% of your body weight can significantly improve liver health. Strive to maintain a body mass index, BMI, within the normal range, 18.5 to 24.9. 2. Follow a balanced diet. Focus on consuming whole, minimally processed foods, including fruits and vegetables, whole grains, such as brown rice, quinoa, and whole grain bread, lean proteins, like fish, chicken, legumes, and tofu, healthy fats, such as avocados, nuts, seeds, and olive oil. Reduce intake of foods and beverages high in added sugars, particularly those containing high fructose corn syrup. 3. Increase physical activity. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, e.g., brisk walking, cycling, swimming. Incorporate strength training exercises at least 2 days a week to build muscle mass and improve metabolism. Look for opportunities to be active throughout the day, such as taking the stairs, walking during breaks, or engaging in recreational activities. 4. Limit alcohol intake. If you consume alcohol, do so in moderation. For men, up to 2 drinks per day, and for women, up to 1 drink per day. If you have fatty liver disease, it may be advisable to avoid alcohol altogether. 5. Manage comorbid conditions. If you have diabetes or prediabetes, work with your healthcare provider to manage blood sugar levels effectively. Maintain healthy cholesterol and blood pressure levels through diet and exercise. 6. Get regular health checkups. Regular checkups with your healthcare provider can help monitor liver health and detect any changes early. Adhere to any prescribed treatments for conditions like diabetes, high cholesterol, or hypertension. 7. Stay hydrated. Staying well hydrated can support overall health and help the liver function optimally. Aim for at least 8 glasses of water per day, or more if you're active. 8. Get sufficient sleep. Aim for 7 to 9 hours of quality sleep per night. Poor sleep can contribute to metabolic disorders and liver health. If you have sleep apnea or other sleep disorders, seek treatment. 9. Reduce stress. Engage in stress-reducing activities such as yoga, meditation, deep breathing exercises, or hobbies that you enjoy. Nutritional supplements may help support liver health and manage fatty liver disease. However, it's important to consult with a healthcare provider before starting any new supplements, as they can interact with medications and may not be appropriate for everyone. Here are some commonly considered supplements for fatty liver disease. 1. Omega-3 fatty acids, fish oil or algal oil. Omega-3s may help reduce liver fat and inflammation. 1,000 to 3,000 milligrams of combined EPA and DHA per day. 2. Vitamin E. Some studies suggest that vitamin E can improve liver health in people with NAFLD, especially in those without diabetes. Natural forms, D-alpha tocopherol, are preferred over synthetic forms. 400 U per day. 3. Vitamin D. Low vitamin D levels have been associated with fatty liver disease. Supplementation may improve liver health. Vitamin D3, cholecalciferol, is the preferred form. 1,000 to 2,000 IU per day. 4. Milk thistle, silymarin. Milk thistle is known for its antioxidant and anti-inflammatory properties and may support liver function. 140 to 600 milligrams of silymarin per day, divided into doses. 5. N-acetylcysteine, NAC. NAC is an antioxidant that may help reduce liver inflammation and improve liver function. 600 to 1,800 milligrams per day. 6. L-glutathione. Glutathione is a powerful antioxidant that helps protect the liver from oxidative stress. 250 to 600 mg per day. 7. Alpha-lipoic acid, an antioxidant that may help improve insulin sensitivity and liver health. 300 to 600 mg per day. 8. Turmeric, curcumin. Curcumin has anti-inflammatory and antioxidant properties that benefit liver health. 500 to 2000 mg per day of curcumin extract, standardized to 95% curcuminoids. 9. Probiotics. Probiotics may help improve gut health and reduce inflammation, which can be beneficial for liver health. 1 to 10 billion CFUs per day. 10. Coenzyme Q10, CoQ10, an antioxidant that may help improve liver function and reduce oxidative stress. 100 to 300 mg per day. 11. Berberine. Berberine has been shown to improve insulin sensitivity and lipid metabolism, which may help reduce liver fat. 500 mg to 1500 mg per day, divided into doses. 12. Artichoke extract. Artichoke extract promotes bile production and supports liver detoxification processes. 300 to 600 mg per day. 13. Dandelion root. Dandelion root is traditionally used to support liver health and may help promote bile flow. 500 to 1500 mg per day. 14. Zinc. Zinc plays a role in liver function and may help reduce liver inflammation. 15 to 30 mg per day. 15. Selenium. Selenium is an antioxidant that helps protect the liver from oxidative damage. 100 to 200 mcg per day. 16. Folic acid. Folic acid is important for DNA synthesis and helps improve liver health, especially in individuals with fatty liver disease. 400 to 800 mcg per day. 17. Vitamin B12. Important for metabolism and energy production, vitamin B12 can support overall liver function. 500 to 1000 mcg per day. 18. Vitamin C, an antioxidant that helps protect the liver from oxidative stress and supports the immune system. 500 to 1000 mg per day. 19. Nutritional yeast. Rich in B vitamins and antioxidants, nutritional yeast supports overall metabolic health. 1 to 2 tablespoons per day. 20. Psyllium husk. Psyllium can help improve gut health and assist in weight management, which is beneficial for liver health. 5 to 10 grams per day. This video is intended to provide health information. If you have a medical condition, please seek professional advice. Thanks for watching. Please subscribe, like and share. Your support is my biggest motivation.